When a patient is diagnosed with pre-hypertension, the default clinical advice is almost always the same: get moving. Medical guidelines universally prescribe aerobic exertion, like jogging or cycling, to raise the heart rate and improve cardiovascular health. Yet recent systemic reviews reveal that this first-line intervention is physiologically suboptimal for reducing blood pressure. A 2023 network meta-analysis in the British Journal of Sports Medicine examined 270 randomized controlled trials to evaluate the efficacy of different exercises on hypertension. This chart shows the results. Isometric exercise, specifically the wall squat, delivered an average systolic blood pressure reduction of 10.47 millimeters of mercury. Traditional running achieved a 6.83 millimeter drop. That delta is significant. A 4-point difference in systolic pressure is clinically equivalent to the impact of adding a standard dose of a pharmaceutical antihypertensive to a patient's daily regimen. Similar results appear when examining neuromotor training. Practices like Tai Chi and Qigong consistently outperform high-intensity aerobic training for blood pressure control. This presents a clinical paradox. Exercises that intentionally maintain a low heart rate are yielding a significantly larger drop in vascular pressure. The answer lies within the architecture of the vascular system. Static muscle tension and slow neuromotor control manipulate the body's internal hemodynamics and neurobiology more effectively than aerobic exertion. To understand why stillness works, we have to look past isolated in-clinic measurements and examine continuous physiological data. In 2024, the Journal of the American Medical Association Network Open published a randomized controlled trial directly comparing Tai Chi against aerobic exercise in pre-hypertensive adults. This diagram illustrates the 12-month in-office measurements. The Tai Chi group achieved a 7.01 millimeter systolic drop, while the aerobic group recorded 4.61 millimeters. The researchers also utilized 24-hour ambulatory blood pressure monitoring to assess the patient's ongoing cardiovascular risk. Continuous tracking reveals a critical biological function known as nighttime dipping, the healthy drop in blood pressure that occurs while we sleep. This graph tracks the patient's 24-hour cycles. During the nighttime segment, the Tai Chi practitioners achieved a sustained systolic reduction of 3.45 millimeters of mercury. The aerobic group saw no dip. Their nighttime systolic pressure actually rose by 0.63 millimeters of mercury. The absence of a nighttime dip is a clinical warning sign, serving as an independent predictor of future strokes and irreversible end organ damage. Despite months of regular physical exertion, the aerobic regimen failed to trigger this biological reset. Slow neuromotor movements alter the body's baseline regulatory state, achieving results that elevated heart rates alone do not reach. To see exactly how these exercises reshape the vascular system, we first need to look at the cellular mechanics occurring inside the muscle tissue. Consider an isometric contraction, like a wall squat or the zhangzhuang standing holds found in Qigong. These modalities require intense, sustained muscle tension with zero joint movement. As muscle fibers lock into place, they physically clamp down on local capillary networks. This mechanical pressure squeezes vessels shut, inducing localized ischemia and hypoxia. Deprived of fresh oxygen, the static muscle tissue rapidly accumulates metabolic byproducts. The critical physiological event happens the moment the isometric hold is released. The sudden drop in physical pressure triggers reactive hyperemia. A powerful surge of blood rushes back into the starved tissue. As this massive volume of blood forces its way through the previously constricted capillaries, it creates intense friction, shear stress, along the inner endothelial lining of the vessels. Endothelial cells respond to this friction by rapidly synthesizing and releasing nitric oxide. Nitric oxide is a potent vasodilator. It diffuses into the surrounding smooth muscle, forcing the vessels to relax and expand. By forcing localized vessels to dilate simultaneously across large muscle groups, isometric exercise creates a cumulative systemic reduction in peripheral resistance. Local vascular mechanics represent only one component of this process. The systemic response is governed by the central nervous and endocrine systems. Modern cardiometabolic pathophysiology maps the underlying drivers of essential hypertension. This schematic illustrates the pathway. Insulin resistance directly provokes an abnormal surge in the sympathetic nervous system. Chronic sympathetic overdrive locks the entire vascular network into a perpetual state of constriction, driving up the structural resistance against the heart. This sympathetic surge triggers a secondary cascade, the renin-angiotensin-aldosterone system, or RAAS, commanding the body to retain sodium and water. It forms a self-sustaining loop. The overactive sympathetic system signals the kidneys to release renin, hyperactivating the RAAS cascade, expanding blood volume and elevating pressure. Tai Chi and Qigong intervene at the origin of this loop through deep, controlled diaphragmatic breathing paired with neuromotor focus. Rhythmic, focused breathing stimulates the vagus nerve, increasing the body's parasympathetic tone. This heightened vagal tone acts as a neurological brake. It dampens the sympathetic overdrive, cutting off the signal to the kidneys and downregulating the entire RAAS cascade. By combining isometric tension with focused respiration, this neuromotor practice mimics the exact mechanism of a pharmaceutical beta blocker combined with an ACE inhibitor. When we map these mechanics together, a complete physiological model emerges. This flowchart models the complete process. On a cellular level, isometric tension creates the mechanical shear stress required to flood the vascular system with nitric oxide. On a neurological level, diaphragmatic control increases vagal tone, suppressing the hypertensive RAAS and sympathetic nervous system pathways. These independent mechanisms converge to produce a significant clinical outcome, blood pressure reductions rivaling pharmaceutical interventions. Aerobic exercise serves a distinct purpose in metabolic health, driving lipid management and glucose oxidation. In contrast, isometric and neuromotor exercises act directly on the hemodynamic structures, repairing the vessel's ability to regulate its own tension. This necessitates a shift in how clinicians prescribe exercise for patients with elevated blood pressure. Cardiovascular health regimens should incorporate targeted isometric holds, such as 4 sets of 2-minute wall squats, to induce optimal reactive hyperemia. Integrating neuromotor practices like Tai Chi offers a proven method for the long-term repair of the autonomic nervous system. Lowering blood pressure does not require pushing the body to its physical limits. Through stillness and controlled tension, patients activate the body's most potent native antihypertensive pathways.